Good evening, everyone. I, Dr. Chaitanya Ganapule, Chairperson of the Endocrinology Committee FOGSI, welcome you all for this Gyan Pravah Podcast Series, which is a brainchild of our FOGSI President, Dr. Sunita Tandulwadkar. And during this 1 hour, we are going to discuss on different topics with today's speaker, Dr. Sanjay Gupte. I will be formally introducing him after Dr. Ashwini's speech. Initially, I would request Dr. Ashwini to say a few words about this Gyan Pravah as a series. What was the thought process behind it? And then we will go on to the formal introduction of Dr. Sanjay Gupte and the discussion or the chat with him for next 45 to 50 minutes. Over to you, Dr. Ashwini.
Thank you, Chaitanya. Good evening, Gupte sir. It is
Good
definitely such a
evening.
proud privilege for me to share Gupte sir today and to be listening to this podcast. I mean, I have seen him right from my childhood days, and to be sharing the screen with him is really a very huge honor for me. And he's one of the pioneers who has led FOGSI, FIGO, and actually opened the doors to all the people of India, to all these national and international organizations. So it would be very wonderful to listen to him from his wide and vast experience of running FOGSI. I mean, now I literally see how difficult it is to run such a huge organization which is spread across the length and breadth of our country with so many different people and different opinions. Sir, this year our brainchild program of Sunita Madam is Sampurna, which is about preconception care. So this is a huge project that we are running for 3 years from now. So which is on optimizing the hormones, the weight, and the nutrition of the women before she conceives, so that automatically it would reduce the maternal mortality and morbidity. So we are in the process of developing the master trainers and taking this program to the length and breadth of the country, up to the remotest areas of places like Tripura and Meghalaya, which really have a very high mortality rate. And the entire thought process behind this Gyan Pravah series is that all the 30 chairpersons of various committees of FOGSI each and given 1 hour wherein they interview stalwarts in various fields. I mean, be it gynecology field, be it the social field, administrative, and politicians. We have even were very lucky to have the podcast of Shri Gadkari ji by Dr. Alka Kuthe madam. So through this for 1 hour, and this is open to all the public also and all our gynecologists also. So this link goes on the social site of FOGSI YouTube channel. So every day we listen to this crisp 45-minute discussion. So we have finished over 100 episodes till now. And we have also done a lot of work in cancer cervix. We have actually adopted Banaras as a city, and we are doing a lot of work there against cancer cervix by treating them for cancer cervix by doing a tie up with the AIMS hospital there in Varanasi, and also diagnosing them by running various tests there. So the major aim is to test each and every woman in that city for cancer cervix by the HPV DNA testing kit. So these are the various programs this year FOGSI is running through, apart from the usual CMEs and all our vice presidential and presidential conferences. And it is really once again an honor to share the screen with you, sir. And I'll join in from the viewers link to listen to this 40 years of experience. Thank you so much, sir, for being with us today. Thank you, Chaitanya, and all the best.
Thank you, Ashwini. And that's wonderful work that you are all doing. Great teamwork. Wonderful.
Thank you so much, sir.
Thank you, Dr. Ashwini, for that formal introduction of all the programs which are run by FOGSI. Let's move on, and let me take the privilege to introduce today's speaker, Dr. Sanjay Gupte sir, formally. He is practicing obstetrician and gynecologist for last 45 years in the city of Pune, and that's why I wanted to have a dialogue with him on the subject of what are the changing trends or what have changed in practice for in last 45 years, since sir you have been in practice for that long. Thank you so much for being here today. He has been an undergraduate teacher for 11 years and was an associate professor for 10 years at Baramji Jijiboy Government Medical College, Pune University. And I have been the privileged student of yours when I was doing my residency at BJGMC Pune. He is currently Secretary General of the World Organization of Justice, an institution that is dedicated to research on hypertensive disorders during pregnancy. He is the former chairperson of the FIGO Committee on Ethical and Professional Aspects of Human Reproduction and Women's Health. He also served as the Technical Research Chairperson for the Indian Council of Medical Research. He is the past president of FOGSI, and that's how most of us know you, sir. Under your leadership, FOGSI launched the National Mother and Newborn India project in collaboration with the Government of India, Indian Academy of Pediatrics, Neonatal National Forum, and this initiative led to the foundation for the government programs like Janani and Shishu Suraksha Yojana for safe motherhood. He is also a former president of DIPSI, that is Diabetes in Pregnancy Study Group of India, and served as a member of the Armed Forces Research Committee under the Defense Research and Developmental Organization, that is DRDO. He has held the positions of President of the Maharashtra Medical Council and the Chairman of the Ethics Committee. With a legal education background, he has played a pivotal role in establishing medical legal conferences in India. Now, among his many accolades, the most inspiring one are the Most Inspiring Doctor in India Award, which he received in the year 2018, Times Health Icon Award in 2017, and in 2010, he was honored with the prestigious Honoris Causa Fellowship by the Royal College of Obstetricians and Gynecologists, London, for his significant contributions to women's healthcare. He received the Lifetime Achievement Award from FOGSI for his outstanding service in women's health. Amongst his social contribution, he has started, along with Dr. Asmita Gupte, his wife, Asmita Medical Foundation, an organization which is dedicated to the personality development among girls from all the social strata. The foundation has positively impacted the lives of over 100,000 girls till date. He also serves as the director of Green Array Genomics Research and Solutions, a specialized laboratory offering advanced and precise genetic testing and genomic research services for patients and clinicians alike. We are very privileged, sir, to have you today as our guest. And as I said, that we are going to discuss about the changing trends in practice for the last 45 years. So let me start with the question that you have been in practice for last 45 years. We would like to hear about your journey right from the beginning. How what made you choose OBGYN as your specialization, and then how did you get into private practice, and how it has evolved over last 45 years?
Right. First of all, thank you, Dr. Chaitanya, for that very kind introduction. And it's students like you who make teachers like us proud. You know, the kind of work that you're doing in our field now is really exemplary. And, you know, this work that FOGSI is doing is now going places, and it's really nice to see that FOGSI has also evolved to this extent now. Well, coming to your question, well, those were the days, you know, in 1970s, actually, when we were doing our post-graduation in Sassoon Hospital. And we had some wonderful teachers there. And as we came across them, one was, of course, the doyen of our field, Dr. Anjanelu, Dr. Lala Telang, Dr. Paranspe, and all that. And so when we came across them, gradually the interest started in this particular field of obstetrics and gynecology. And
So that was during your undergraduate days?
Undergraduate days, definitely. And one realized that, you know, the pediatricians and medicine people had to be really, really, you know, smart. They always used to stand first, and you know, all that. And so the next best was either surgery or gynecology. And gynecology, you know, and obstetrics especially, I started liking, because that was only one field where one didn't feel really intimidated, you know, with what one was listening to, you know, especially as undergraduate, all the diseases and everything. It was always, you know, the happier situation in obstetrics, and that's what one started liking, and that's why finally I went for the gynec and obstetrics. And of course, again, I was lucky to have Dr. Anjanelu as my first mentor and Dr. Lala Tilang as my second mentor. And not only that, in the as we were doing our housemanship and post graduation together, I met my now wife, and that's became a team, and that is continuing till now quite successfully. Right. So that was about choosing gynec and obstetrics. Okay. Right. And again, as one goes into obstetrics, one realizes, and those were again the days where now the technology was not so advanced to that extent. We didn't have even ultrasound at that time. People are surprised. Many times nowadays the patients come to me, and when I examine them and tell them, oh, baby's like this, but they say, but you didn't do the ultrasound, and I have to always remind them that when we started, there was no ultrasound. So so that's always, and they're quite surprised to hear that, because everybody expected that has been there for ages, and
Ages.
that's a must, and all those kind of things. So the things have changed. I started with a very small 5-bedded hospital at that time in the central part of city of Pune,
And you
and
didn't have any family background of medicine.
absolutely not. Absolutely not. Nobody, my, father, mother, they are, lower middle class people. My father was in government service. And so I was probably the first person to get into medicine. And naturally, the parents were very, proud of that fact, and always backed me. So we started this 5-bedded hospital around
But
my.
I'll just
Sure, sure,
stop you
sure.
in between that you said your father was a government
Yes,
employee.
yes,
And when you thought of starting your own hospital, did
correct.
you get any resistance from them, or was they keen on you joining the government service as well? Because probably
Absolutely.
getting government service at that time must have been a little easier thing to do than getting into a private practice.
Absolutely. In fact, you will be surprised that whatever my father was earning at that time, very comparatively, little sum of some 1,500 rupees per month. And when I joined as a lecturer, I started getting, 1,700, rupees per month. And then when I became associate professor, it increased a little further. So he was quite shocked why I'm leaving the job and getting into private practice where there's no certainty that
Correct.
the practice will run. And yes, there was resistance, but I had to convince him that my wife was also there with me as lecturer and associate professor. So at least, she will continue for some time. So we will not have to come to him to ask for money. So, according to him, it was a huge risk-taking thing. And at that time, the people were very conservative in those days, absolutely. Yeah. Uh-huh.
And how did it evolve? You started
Right.
the four
So
bed. Yeah.
that was the hospital. The good part of it was, and as I said, there were a lot of hospitals of stalwarts all around, my place. But again, the good part was my own teacher, Dr. Sindhubai Paranspe. Her hospital was hardly 100 meters from, my place. And when I told her that I'm thinking of starting here, she in fact encouraged, okay, good, these are the places where all the gynecologists are around. And so people are used to, coming here. So you do start here, so she never
Oh,
discouraged. In fact, she encouraged, me to start. And that was quite,
it's a nice thing to do.
heartening, thing. And gradually, the background and the teaching that we had in obstetrics in Sassoon Hospital really helped hugely. You know, you wouldn't believe the first delivery that we did in our hospital was a doctor, and in whom we had carried out external cephalic coercion when she was breach at 34, 35 weeks, and then she delivered normally. So, those were the kind of obstetric procedures which are not only taught to us, but we are expected to, carry out. And
Probably, if I ask a resident who is doing post graduation right now, what is ECG, probably they may not be able to tell also what is the meaning of ECG, probably.
That's true. That's true. Again, at that time, forceps application was quite in vogue. In fact, high forceps, rotational forceps, and Dr. Anjanelu and Dr. Lala Telang were the only two people, doctors who actually applied this Keelan's forceps, and Dr. Lala Telang used to use Mulgaonkar forceps. By the way, he has gifted that to me, and I still have that, with me, the rotational forceps. Again, if you ask me, and this is again, as a president, I went around, FOGSI president, I went around India, and you may remember, we had workshops in operative obstetrics. And when we went to, somewhere in Uttar Pradesh, the young graduates asked me, MD graduates, "Okay, but why are we talking about this? Isn't this obsolete now?" So I was quite surprised to hear that. Said, "Oh no, it's not obsolete. It's very much in vogue."
But
So
the days have come that, sir, the art is really missing as far as the forceps is concerned. So
right,
now most of them are using vacuum.
that's
And
right, that's right,
maybe
that's
it's
right.
time that we reintroduce the forceps in practice, and how to apply it, and it's an art which is lost over years.
Over the years. Yeah. But we should try and preserve it. I think Dr. Nargolkar in our city has done, really yeoman's work in, forceps, and, he has his own, his Nargolkar forceps he has developed. And so we have a tradition in our city, and I think we should maintain that tradition.
Yes.
You all, we are looking forward to maintaining that tradition.
That's true. I have one of those which was developed by Dr. Narwalkar, and
Right.
he has taught. He actually showed me on a few patients how that needs to be applied. But as you rightly said, we have to keep that art going by
Going.
teaching the new people who are coming in.
That's
So
right.
how did you transform from a four-bedded hospital? And I know that at present you are running an almost 50-bedded maternal and child care unit. So how that journey went through?
Right. The important part, and I must say this, at that time, though we did not have technology, what we had was complete trust of the patients. The relationship of doctor and patient at that time was vastly different than, what it is today, sadly. And even if some mishap used to occur because technology was not there, people used to say, "Oh, you tried your best," and so it's our fate that this has happened, and nobody used to really blame the doctor for that. When they used to see the efforts that were going on, they were very happy with even accepting mishaps at that time. And even another thing at that time was that they looked at the doctor as a person close to them. They believed in what the doctor did, and they did not bother about what were the facilities at that time available. That was really great, because in that, you wouldn't believe, in that five-bedded hospital of mine, which was all general beds only. Obviously, in five beds you can't have rooms and all that, and very small, barely 800 square feet place, just one operation theater, same which used to serve as a labor room also. But a lot of people, renowned people from Pune came, and since Dr. Ashwini mentioned about Gadkari Saab. So his very close friend, Bapat, Mr. Bapat was MP from, people like him, another, stalwart from other Congress party, Kalmadis and their family, they used to come And they didn't mind being in the general wards, though the much bigger hospitals were available. And I must tell you this story, and that's very interesting, that once this my hospital went on for a couple of years, and then that time that Pune hospital, which is a big multi-speciality hospital, had started nearby to my place. So I had joined there as honorary consultant with them, and I was also having an OPD there and keeping some of my patients there. And they opened a VIP ward. They built and opened a VIP ward there.
Okay.
And the trustees came and told me once, sir, you must now deliver, one Mr. Kadam, who is coming to you, his wife is coming to you now for second delivery. First you delivered, but now this time you must deliver her at our new VIP ward. So I said, who are you talking about? That was this thing. And then they said, you're joking, you don't know Mr. Kadam? I said, no, I don't, recollect. So how is that possible? He is the, second most important person in Bharati Vidyapit, Shivaji Rao Kadam.
Okay.
And I'm sure he won't mind my directly, speaking about it publicly also, because, all throughout the first delivery, he and his wife used to come, and he was again a very, very big person in Bharati Vidyapit, but they used to quietly come, sit in the OPD. And, I never came to know that this person was such a great person, at that time. And when these people came and told me, then, I approached him, Arey, you didn't tell me. So, no, no, first time everything had gone well, so why should we bother you? We didn't tell you. So those were the kind of people, that they used to come with, faith and, trust. Another story, and again, an anecdote that I must tell you, is that when from there, we moved to our, first hospital in, Deccan, which was about, 12, 14 bedded hospital. And there, you know, because the hospital was small and we wanted it to be kept clean, we used to, expect all the patients to remove their footwear, outside outside the house, just in the, just out of, out of the door there. And sitting arrangement was all over there. And once, really that time, Dr. Gowarikar, who was
Vasant Gawarikar.
scientist in ISRO, he was guru of Abdul Kalam. Kalam Azhar used to call him his guru, and that person came with, his relation. And well, there were no appointment system, just number, and people used to sit outside. And so I didn't come to know that he had come, and neither my staff unfortunately recognized that, such a great person had come. And he came inside almost after, couple of hours of waiting. And jokingly, he told me, you know what? I counted there are 56, pairs of footwear outside. I was felt so sorry. I said, so very sorry. You're obliquely telling me that that's how you have to wait. And so I'm very sorry. And next time, please give me a call and come so that you don't have to, keep on waiting. But again, those were the type of people. What I'm trying to say, the relations of the people with those were, I mean, could have just called me even at his home and I would have gone. He was such a great person, to see. But they're really humble people, and that's how the world was at that time. And that's why it was a lot of fun actually practicing, a lot of enjoyment in practicing at that time.
So do you think that the medico-legal aspect which has come in the medical practice changed this doctor-patient relationship? And do you think that will it be possible for people like us or the next generations to go back and have that kind of a relationship with the patients?
Right. You're, absolutely hit on the nail, absolutely. Because till about 92, 93, practice was, as I said, all trust-based practice. Then came the CPA. And though the CPA had its good intentions, but you know, it went in a very wrong way, I must say, because even in those few years, there were almost 3 or 4 cases against doctors in city of Pune. I think city of Pune led medical legal cases also, initiated at that time.
Okay.
Very first cases were from city of Pune, and they went against the doctors. And so, fortunately, for some other reasons, I had done my LLB at that time. When I was practicing only, I could do my law, and that's why
Had you sensed it?
um, pardon me.
Something of this type is going to come in our practice. That's why you did it even before others could know that CPA is going to be there.
Well, I was lucky to have again, good friends like Dr. Navarangi, Dr. Bere, who also, goaded me into, and we 3 of us were the first ones, in fact, to do the, law, being doctors,
Okay.
this. But that, yes, that started changing things. Then we realized that, some defense in the courts is always available. So it's not just what you talk to the patient, but you're to create documentation. Then gradually the defensive medicine, so you have to have these investigations, you have to document, and these things, though they're good things, in the long run they're not bad things, but that somewhere shattered that close relationship that the patient and doctors used to have, and it became more formal. And unfortunately, now in Google, Zamana, it is becoming, worse than what it was. So now it is, of course, formalized. Yes, there are a lot of advantages, because maybe at that time, doctors used to get away with a lot of mistakes, which is now, to some extent, to some extent, I won't say to all extent it is reduced, but so I think overall, the way the CPA was applied has done a lot of damage than, really into the relationship of doctors and patient together.
But then, will it be possible for us to go back to that kind of a relationship, considering whatever good part of it needs to be implemented?
Correct.
After that, would it be possible for us to go back to that kind of relationship? And if so, what should be done from our end or our side, to gain that trust or confidence of the patient?
Right. See, 2 things. Yes, if the CPA is slightly even modified, and good judgment with doctor's expertise come in, then, the first of all, this CPA will get a place as it should be, getting. Okay, that's one thing. Secondly, leaving aside all this, what I always believe is, the patients out there, or don't care what you know, what your knowledge is, or they want to know how much you care. That's the bottom
Very
line.
important point. Very
Yeah. So if you care, still, there are patients who will, totally trust you, and not even think of going against you in court of law. But that care must be, actually be there, and has to be seen to be there also. And that makes a lot of difference to the doctor-patient relationship.
So we should not be very much afraid about this CPA, and as you said that it has its own place, but we should, I mean, show that care, and not only show, but I mean, it has to come from inside or within, that we really do care for you, and that then automatically it comes in your body language also. It comes in the way you speak, the way you behave with the patients. So
Absolutely true. And that's why, and yes, now we have to accept that, these norms are there. We have to have our SOPs, we have to have our checklists. And so definitely what has happened is because of this, we all started using the proper technology, proper documentation, and that has definitely improved the practice to a great extent. There's no doubt about it. So CPA also help in, sort of updating the whole, process in every field. That again has to be accepted. And as I said, it's CPA consumer protection is a must. There's no doubt. It should be applied in a proper manner to improve doctor-patient relationship. And if very consistent judgments are there, when evidence-based judgments are always there, then that will in fact enhance the practice, and doctor-patient trust also it can enhance.
Great. Good inputs on that end from your side, sir, which we can implement in our practice. Going back to the changes which have happened over last 45 years in practice, what are the changes that you feel dramatically changed the way you practiced for last 45 years?
Right. I think the main thing that has come in is technology, and that's not only in our branch of obstetrics and gynecology. It's more so in fact in other branches as we see it. But if we restrict to our branch of obstetrics and gynecology, the ultrasound came first. Then came the scopies, laparoscopy, hysteroscopy. Now robotics is coming in, and of course the complete change in infertility treatment with IVF procedures, and now the newer fetal medicines and intervention for the fetus itself. So the scenario is hugely changed now, completely changed, and technology has to gain its own importance. And that's why I think there is more need now to, for gynecologists and obstetricians to choose even sub areas. Because if you are going to do the work of excellence, our time it was different. We used to do everything a little bit, probably one may say jack of all trades was the situation at that time. But now if one has to achieve excellence in the field, one has to concentrate on maybe just one or two areas, and go ahead with that, and leave others to colleagues, and have a team kind of situation where everybody can do the work of excellence.
So, do you think, sir, group practice, wherein each one of us, as you rightly said, is going to be an expert in a particular field and not exploring all the things at a time, would be a better way to practice in future?
Absolutely. Again, and what I believe is, if we are to have hospitals which really give care the way it is, required for the patient, then this group practice has to be amongst the doctors, and we should not, leave it to, unfortunately.
I'm getting where we are.
Yeah, that. So yes, again, the problem there usually is, the doctors' egos come in the way, and that's why in the past this has not been very successful. But now I think all the doctors have realized that those egos have to be kept aside, and one has to develop one's own field, and definitely join in with others. And so now I think the chances of success of any such ventures would be much more, and which will be much more successful than other ways, and I think much more beneficial to patients also.
So you said that ultrasound, then came endoscopy, then came robotics, then came IVF, ART, infertility management, treatment, fetal medicine. How did you adapt yourself to these changes? And did you introduce all these different segments into your practice?
Right. Now, as I said, initially one thought that, okay, why not, I learn this, I learn ultrasound, I learn scopy, I learn IVF. I went to, Singapore and did a course in IVF. I went for the courses in scopies and all that. And I was doing all that. Well, basically, I realized that, obstetrics takes such a lot of your time that you cannot do all these things yourself. And then that's why I started getting, associated with others. So, and all these fields, I was lucky to have you as my, associate in laparoscopy at that time, and, so we associated and introduced this. My very close friend, Dr. Kindre was, wonderful ultrasonologist who was right next door to my hospital. So that was an asset. Patients just had to, cross 10 feet to approach him. So it was like in my premises also. And he was at that time the best ultrasonologist in city of Pune. So again, being where at what time matters, and what friends you have also matters, So I think I was lucky in that sense.
But then, sir, it's not only just the luck factor. You also need to have that vision that these things are going to change the way we practice, and then I need it to be incorporated into my practice. And that's why, probably you also approached Dr. Kindre also when he joined you, or you encouraged me to take up endoscopy when I just passed out of my residency. So you had that vision that these things are going to change dramatically the way we practice, and you need to adapt to those changes. So if you would have not done these adaptations and changes in your practice, probably do you think that the things would have been different?
Vastly different, definitely, because there is something like a need of the hour, and you have to anticipate it and follow it and find out ways of how the best possible care can be given to the patients. Definitely, that's true.
You just brushed upon the subject a couple of questions back. I will come back to that question now. That we all know that there is a corporate culture which is brewing around all of us, and that's threatening the nursing home culture or the practice. Now, there's a huge difference in the way a corporate hospital works or functions and a nursing home functions. What are your thoughts about that? I know that you are very vocal about your thoughts on that. So we would like to hear, because that's going to give us quite a lot of insights about the future.
Right. First of all, when CPA came in, then our patients we started calling as our customers and clients. That was first unfortunate thing that happened.
Yeah.
And the next unfortunate, naturally, when you have clients and customers, then you have to you develop kind of a business model, and that's where this corporates came in. I remember one of my very close friends who is CEO of a multinational pharmaceutical company. He had told me long back, almost 25 years back, that plainly, because he was very close, he's still a very close friend of mine. He has told me at that time that you doctors are quite stupid. You know how to do the things clinically well, but you do not really know how to run the hospitals. And people like me who are entrepreneurs are going to take over your field, and you will be just working as one of the employees of that those entrepreneurs and corporates. And unfortunately, his words, his vision that was there is coming true now. And I think that's where the doctors are not very smart in utilizing it. See, there are some advantages of corporates because they bring in money, they bring in facility to this thing. The facilities improves, the equipment improves. But finally, the corporates are there not to do charity. Obviously, corporates are meant to go in for profit. And obviously, this profit comes out of the pockets of either the patient or the doctor. They say, and that's we have to understand. And that's why if we allow the corporates only to take over, the small hospital is not going to be there. The doctor-patient relationship is not going to be there. A lot of things can be talked about what things go wrong in the corporates also, though there are five-star facilities. One would, the patients do like to, avail of those facilities. But what has happened now is because of that, the patient culture has also changed. Now, recently, I had a patient who had delivered just about 3 years back in one of the corporates in the city. I will not name this thing, but I asked her, okay, so you delivered. How was it there? She said, no, I was not very satisfied with my treatment. So I said, who was your doctor? So she remembered. I don't know. I went to this corporate hospital and the doctor there treated me. So she didn't even remember the doctor who had delivered her. So that came as a really shock to me, because our culture is entirely different. The people whom we delivered 25, 30 years back, they come with their children for their delivery. That kind of connection we have. And now patients don't remember 3 years back who delivered them. So the importance of doctor's care is reduced so much, in the patient's eyes, that is really something which is detrimental. And that is something that we need to remember, and we need to maintain those relationship. And that's why I said entrepreneurship through the doctor's efforts will be much appreciated and better for the patients and doctors together.
So if we have to fight this corporate culture, we need to come together and we need to start having a group practice or anything which will be doctor centric rather than the corporate centric, and maybe the business culture which has come into it will go down.
Correct.
Is that what you?
Yes, and then only it will remain patient centric. Otherwise, it's not going to remain patient centric also.
Right.
Mhm.
Lots of things we need to think upon. We need to आत्मपरीक्षण करायला पाहिजे. So and we have to come out with some strategy. Otherwise, the era of nursing homes would be a history soon.
Just
So,
like family doctors, we have lost on, the same thing. We used to be kind of family doctors for our, obstetric patients always. So that is also going to go away, if we are not careful now.
So you have been lately into genetics a lot. We hear you in many different conferences speaking and talking about it. So tell us more about what all what made you enter into genetics after practicing as an obstetrician for 40 years. Suddenly changing, or is this also a part of the vision, or what you see as the change again in practice which is going to happen in future?
Yes. That's in a way right. That is my latest passion, in fact, genetics. How it came about is, in our branch, whatever we finally try to diagnose, we finally do not have the answer. That means, okay, preeclampsia, why is it, why is it developed? We don't have endometriosis, why has it come up? We said, okay, we diagnose it, we treat it, repeated pregnancy loss, premature labor, especially even if we take just our own branch, there are so many unanswered, questions. We diagnose, we treat, but we do not know the root cause of the thing. And if we have to know the root cause of any medical condition, I think finally the answer is going to be in genes. Not only now, people say when genetics, well, if genes are there, what can we do? We cannot change it. But that's not so. Now we know that there is something called as epigenetics. So gene expression matters. Gene expression can, change even in many situations, even if the genes are the same. Secondly, now the new science of microbiome has come in. She's telling us that, we can just by lifestyle changes, by the food changes, by probiotics, we can improve a lot of situations which initially we thought that were impossible to change. So this is also the vision of the future. Now the gene editing is also coming in. So even the genes. So in next 10 years or so, everything is going to be gene based. Everything is going to be, and no matter what branch you are. Recently, we are seeing now young people dying of cardiac arrest. I mean,
Absolutely.
yes, we can, and athletes and those who are fitness, professionals, fitness freaks for that matter. That is, we have to actually check their genes, and then we will find answer. We are already, there are panels available now, genetic panels, where this can be predicted. So we should advise people to, go in for this test before, going for a lot of adventurous and heavy exercises and so on, so forth, and get in trouble. In our own branch, of course, as you know, right from PGTA, where we can find out what is, how good is the embryo, whether it is having any this thing. Then Ashwini talked about preconceptional, care that FOGSI is, taking up. The preconceptional care is mainly about, genetics and gene expression, and that's why this has to be taken up. HPV that she talked about. Now, we in our laboratory have developed a test which is a self-testing kit. So it's so easy to use by the patients herself, because why the patients, don't go for the testing? They're embarrassed. They have to go to the doctor. Then the doctor will take the swab, and then the test will be done. But if they can do that at their home, there's nothing like it. Everybody will want to test themselves. And those are the kind of innovations will come only through this genetic science, and that's what we have to opt for more and more now.
Wow. So it's going to be the future, and we all need to look out for that, what's happening in and around that field, and how that is going to help us in our practice as well. So you have set up a genetic department at your hospital, and you are undertaking quite a few projects. So
Yes.
can you just tell us about what all projects here, because there could be many people who might want to join,
Certainly.
that projects.
Certainly. See, now what we are doing is, first of all, type of testing is done. As I said, starting from, the preconceptional testing, where, carrier screening tests are there. Then prenatal testing, like where NIPT kind of, tests are there. We can check the DNA of the baby itself. Then repeated pregnancy loss, where product of conception can be checked. Then PGTA, PGTM kind of situations, where actually the embryos can be tested. And now, something interesting for you all is there is non-invasive PGTA available. So now we
That's
don't
coming
have
up
to,
in a big way.
we don't have to even do the biopsy of the embryo to do this. Then for preeclampsia diagnosis, there are now, genetic expression testing. Endometriosis, these are the projects are, that we have taken up, and will be coming out with these, new tests, hopefully, soon, once we validate them, that how to diagnose preeclampsia quite early in first trimester. Then similarly, how to diagnose, endometriosis, because you are, expert endoscopist. You know that people come to you, fairly late, when
Absolutely.
endometriosis is already,
Absolutely.
spread around, but it starts in adolescence. So how can we, and we can't expect the adolescent girls to undergo scopy for diagnosis. So we have to have some very easy markers, which we are hoping to develop. We are in the process, and will hope to develop. And yes, as you rightly pointed out, if people, others want to join in these projects, they're welcome, because we need, positive
Data.
samples. We
Yeah.
need data. We have done, for example, cement microbiome, and we have now a data of more than 500 patients who are apparently, the semen report comes as normal by WHO criteria, but there is no conception.
Oh.
We have seen, if semen microbiome testing is done, there is a huge dysbiosis. And now, when we have treated patients with specific probiotics, by their report, going by their report,
Okay.
then we are getting, early results in the same
We
patients.
can individualize
It has to
the
be,
treatment, whether it is needed.
all probiotics are not the same. We have to find out what is the, just like urine culture or blood culture we do. We have to find out, what is needed. and then according to that, we have to try to improve it, So that goes a long way in really getting success.
Wow, that's a very interesting field of genetics, and I would urge all of those who would like to, join in this, can always get in touch with sir and the hospital.
Simply one thing, what we did was, with this test that I mentioned you, we are doing HPV not just 16 and 18. We are doing all 14,
Oh,
high risk this day. And what have we found? That in various parts of India, in samples of, the CA cervix, it's not just 16 and 18, 33, 31. These are coming as quite high risk in Indian population. And again, in areas, there are now papers published from Karnataka, from, Gujarat, where they have also found, 16 and 18 are just the ones we know, but others are also equally important
and
as far
probably
as
these
our country is
those are the ones
concerned.
who are more prominent in the Western population, but
Correct.
the scene or scenario, the picture is not the same here in India. We might have to develop vaccine also against different subtype of.
Absolutely. You hit absolutely nail on the head. We'll be requiring, vaccines covering all these strains for India. Absolutely true.
Okay, great. Sir, you are the past president of FOGSI, and you have worked very closely with FOGSI and women health in India in general. So, would like to know from you, because we have 5 minutes more. So, a couple of questions I might cover. I have a list of them, but I would cover a couple of them more. So,
Okay.
what has changed over time as far as a woman health in India is concerned, for good and maybe not for so good? And
Right.
there is a possibility of improving the things in future.
Right. What has changed for the good is that there is huge awareness. I remember giving a presentation as president of FOGSI in front of then, Prime Minister Manmohan Singh ji,
Oh,
and at that time our MMR was somewhere around 300. You know, and now it has come down to less than 100.
yeah,
So
97.
there's a yes. So now there's a huge awareness, huge change in last few years. Also, a lot of projects that even through government are implemented for women's health. So the huge recognition is there. I remember that time there was a person called as Dr. Padmanabhan, and the anemia used to be a problem. At that time a huge, still it is, but at that time a very big problem. And when we talk to him about this IV iron and
Fine.
how that can overcome this. He was in that time rural health mission was there, and he was heading that rural health mission. He went into the data, looked at everything, and he said, yes, this has to come in government program. And that's how it came in government program. And I think we have done wonders with correction of anemia
Yeah,
through this. So,
yeah, that.
and now, of course, 90, 70, the 90 for HPV testing is there. Then we need to look into our gestational diabetes situation. Then PCOS situation, which are, absolutely interconnected. Yes, there is now awareness. DIPSI took that up, and we have now the DIPSI test, which is
Developed
applied
specifically for
universally.
Indian continent. Yes.
Yes, it's universally applied. So a lot of good things have happened. A lot of things can still improve. I think our associations have to basically concentrate on standardizing our practice, and we should leave everything aside. Fortunately, Foxy had a lot of this, we call it, as we call it GCPRs, or good practice guidelines, but this should come in a very big way, and that will be a good guidance to our doctors ki what needs to be done in a given situation. So the practice will be standardized. This will also, by the way, help medico-legally people practice to these standards, the courts will also appreciate and they will not hold the doctors responsible. So rather than, spending a lot of time in other issues, I think we should have this core competence of improving our, own field by creating, debating, creating, and having proper GCPRs. And especially because our country is, vastly different in urban and rural areas, they will have to be slightly modified for rural
Modified
areas.
protocols.
And
Yeah.
that's-
Okay. So last question for today. What advice you would like to give the young doctors, those are pursuing OBGYN or who have just entered into practice? I would like you to give them some pointers that these are the things what you should look for, do and don't.
First of all, I would like to tell them that gynec and obstetrics is a very exciting field. You know, Uh, in fact, that's the obstetrics is the only thing which AI will never replace. All other branches of medicine may be replaced, but
That's so true. That's so true.
but
Because we already have AI in IVF doing ICSIs also. We already have AI which choose the embryos
right.
for us.
But no AI is going to do deliveries, so that always going to remain there. But other than that, it's always a happy situation. You're doing always something good to the patient. The outcome, you're going really great, outcomes, and you have to look at this branch in that sense. We are not getting just ill patients whom we are treating and sometimes correcting, sometimes not able to correct, but we are giving always, most of the time, a happy outcome, and that should really that should be an incentive to people who are entering here. And then, of course, as I said previously, one has to choose a field and do something of excellence, definitely. And that's why now subspecialties is going to be something of the future. And one has to choose whatever one likes and then do it with full passion. Don't think of doing everything.
Here, what's happening is, sir, when you come to the subspecialties, more and more youngsters who are passing out, or even those who are the ones who are actually doing their residency, if you ask, what do you want to do once you pass out? Most of them will say, I want to do either fertility, I want to do endoscopy. No one says, no, I want to do obstetrics willfully. So probably that needs to change somewhere. Your thoughts or your words of wisdom would change their outlook.
I think here I will also expect the teachers to imbibe the spirit of obstetrics in these
Wonderful
fields,
thought.
because
Wonderful thought.
that is because then only it's going to, how do they choose it? They look at the world, they look at this thing, but if they understand what is there to really spiritually and mentally gain by doing deliveries is not just the eyes job, and this is the real art. Other might be science, but this is the real art. And that's why if they get into it, I think they will really like doing it. And then even if one has to stay at night looking after the patient, that doesn't appear like a burden. You're doing something. Just applying difficult forces and delivering a baby is such a huge sort of gives you a really big high. Actually, you've done a wonderful thing for the patient and that baby. So
There, here your advice that you gave of group practice would also come in handy, because one of the reasons why people are moving away from obstetrics is that they have to stay awake whole night, and then the word which is talked about a lot is work-life balance. That is lost somewhere, and that's the reason why obstetrics is not a very attractive branch anymore. But there, as you advise, that if you come together and if you can divide the work amongst yourself, maybe that can again give some
I think again, wonderfully said. I think that should be the thing of the future: teamwork and sharing your time so that you get adequate time for yourself and your family also, if your colleagues are with you.
Okay, okay. So anything else you would like to tell all of us who are listening to you before I wrap up?
No, I think we are fortunate to be in this field of medicine and in this field of obstetrics and gynecology. The world out there, the patients, everyone has given us huge respect. They still give us a lot of respect, though we hear many this thing of violence against the doctor and all. But overall, if you see, we are definitely privileged people, and so we should act accordingly, and we should maintain that respect by our own behavior and own care to the patients. And then these doctor-patient relationship will, as you mentioned, maybe go back a little as in trusted relationship than what is becoming now.
Thank you so much, sir. It was wonderful talking to you for last almost 55 minutes. The time has passed so fast. We didn't realize that it's been 1 hour since we started talking. But thank you so much once again to be on this platform of Gyan Pravah, and on behalf of the FOGSI. I would like to thank you once again for being here. And
thank you for having me here. I think that's a wonderful platform that you've created, right?
thank you so much, sir.
Yeah.
Thank you.
Okay.
Okay.